So we originally talked about the baroreceptor reflex and what it was. So it's a pressure receptor. The common regions for the vascular system where it's present is here. What we talked about is the aortic arch and the carotid sinus. And in these receptors, they're responsible for the measurement of the different levels of blood pressure that is being taking place, right? So before we talked about high blood pressure, now we're going to talk about low blood pressure. So there's an instance of low blood pressure. And so as we enter the aortic arch or the carotid sinus, you notice that because of the low blood pressure, this carotid sinus and aortic arch, the baroreceptor that's within them, is not stimulated. And this lack of stimulation causes the brain to have a decrease in the cardiac inhibitory center, and an increase in the cardiac accelerator center. Accelerator center, right? So because of this problem before, as you remember from the low blood pressure now, there is an inhibition, right? So there's a lack of stimulation of the cardiac inhibitory center in the brain, right? So because of this lack of inhibitory center, the accelerator center of the brain becomes very active. And so what does this cardiac accelerator center do? Well, it causes an increase in a sympathetic response to the heart and the blood vessels, right? So in the heart now, you have an increased heart rate, you have an increased cardiac output, you have this increase in sympathetic activity. Also here, because of the lack of the inhibitory center from the brain, now you have this vasomotor impulse that is generated into the blood vessel. So the vasomotor impulse. So this leads to actually the constriction of the blood vessel. So it leads to a decrease in the diameter, right? So we have instances of vasoconstriction. So what would happen to the resistance? So if we have vasoconstriction, this leads to an increase in the peripheral resistance. This peripheral resistance now becomes an instance where cardiac output increases, and because of the increase in resistance and the increase in cardiac output, this leads to an actual increase in blood pressure. And so this is a homeostatic balance where during low blood pressure, what is being stimulated and what is not being stimulated. And it all begins with the activity of the baroreceptors.